We now discuss about the liver. And liver is the largest gland in the body. It lies in abdominal cavity almost entirely to the right of the medial plane and extends downward forward from the lumbocostal angle to the level of 8th rib. So liver is located in the almost entirely abdominal cavity. In this abdominal cavity, it is extends from lumbocostal angle to the level of 8th rib, and it is in the red brown in color, and average weight is 4.5 to 5.5 kg. So it presents of two faces and the four borders. Let's discuss about these two faces. And these two faces nothing but visceral face and parietal face. In this parietal face, it is convex and most part applied against the right part of diaphragm. In this it is convex, but it is in this most part is it is applied against the right part of diaphragm. Only small part is direct contact with the last two ribs and a flank out of the lumbocostal angle. So parietal surface may most of the part applied against the right part of the diaphragm. Only small part direct contact with last two ribs and flank at the lumbocostal angle. And it has also this parietal surface also attachment for the falciform ligament attached to the surface. Parietal surface is to this parietal surface falciform ligament is attached, extending from the esophageal notch to umbilical fissure. It is falciform ligament is attached, and small area parietal surface has no peritoneum covering, and it is directly adherent to diaphragm. So it is directly attached to it attached to adherent to diaphragm, so it has no peritoneum. And let's we discuss about the visceral surface. Visceral surface concave and the parietal surface is convex. So it has a very irregular, and it presents the impression of organs with which it has contact. So it presents the impression of organs with which it has contact. First impression is omasal impression. Omasal impression, omasum ko impression or omasam ka impression. Reticular impression, reticulum ka. Cystic impression, cystic bile duct. And portal fissure. This portal fissure is a well-defined depression situated dorsal to omasal impression. So portal fissure is located dorsal to omasal impression. And let's we discuss about the borders. And not only falciform ligament attached to parietal surface, it has the blood vessels and bile ducts and several large hepatic lymph glands. So dorsal to lateral of two falciform ligament, part of pancreas also attached. So it has two surfaces. It has parietal surface and also visceral surface. As we discussed about, parietal surface is convex surface and visceral surface is concave, very irregular surface. And in this we discuss about the four borders. So dorsal border, ventral border, right border, left border. And dorsal border, it has short and thick. It has large quadrilateral caudate lobe and deep depression, renal impression of the right kidney and adrenal. So dorsal border is short and thick, and it presents the large quadrilateral caudate lobe and deep depression and renal impression of the right kidney and the adrenal. And the ventral border is short and thick. What we discussing about the ventral border, and it is short and thin, and the dorsal border is short and thick. So dorsal is thick, ventral is for thin. Here n is n there na, so n for thin. So next we discuss about right border. Right border is marked by umbilical fissure in which round ligament is attached. right border is marked by umbilical fissure in which round ligament is attached. Umbilical round fissure. Okay, so we discuss we can remember as also right round ligament for umbilical fissure, round ligament for umbilical fissure. And left border, it presents as esophageal notch. Left for elbow, right for umbilical fissure, right to umbilical fissure. And right oscar means round ligament, RU. And it is elbow means left border, it has esophageal notch. And above this left border, above this the left border is median position, large as the posterior vena cava, which is embedded in this gland. So in this it has a posterior vena cava which is embedded in the liver. Above this left border, posterior vena cava is present in the median in position, which is embedded in the liver. So we discuss about the two surfaces, parietal surface and visceral surfaces, and we discuss about the four borders: dorsal border, ventral border, right border, left border. Dorsal border is short and thick, ventral border is short and thin, right border is it has marked by umbilical fissure, RU, umbilical fissure. Left border, it has esophageal notch. And above this left border, it has in the median position posterior vena cava is present, which is embedded in the gland. And now we discuss about the ligaments. And ligaments, about these ligaments, first ligament is right lateral ligament. Right lateral ligament ka, and it has 5 ligaments in this cattle. We discuss about ox. So it has 5 ligaments, right lateral ligaments attached dorsal border to the sublumbar region. Right lateral ligament is which attached dorsal border. So we discuss about the 4 borders. उसके 4 borders can dorsal border and ventral border, right border, left border. We discuss about these 4 borders. So this right lateral ligament attached to dorsal border to the sublumbar region. And next we discussing about of caudate ligament. This caudate ligament attached to caudate lobe to the ventral face of right kidney. So this is attached to caudate lobe and ventral face of right kidney. Caudate ligament is attached to caudate lobe only. So we can remember easily as caudate ligament को उसके caudate lobe का attach है ना, and to the ventral face of the right kidney. And last way and third is we discussed about falciform ligament. Falciform ligament is concentric fold which attached the sternal part of diaphragm and the parietal surface of liver to the parietal surface of the liver. Sternal part of diaphragm को और parietal surface of liver को अटैच करने वाला को, वे दोनों वालों को अटैच करना है falciform ligament. It is nothing but concentric fold याद करना है, concentric fold. And next we discussing about the fourth. This is round ligament. Round ligament which is in free border of the falciform ligament. Round ligament is a free border of falciform ligament. Extends from the umbilical fissure to umbilicus. It is extended from round ligament is extended from umbilical fissure to round ligament is extended from the umbilical fissure to umbilicus. And the lesser omentum attached liver from esophageal notch to portal fissure. Lesser omentum is directly attached to liver. From where it is attached esophageal notch to portal fissure with the parietal surface of omasum. Omentum omasum, parietal surface of omasum. So उनका नाम है ना, नाम ने omentum है. Omentum को we can understand that it is attached to with the parietal surface of omasum. Okay. Round ligament is which is in the free border of falciform ligament. which is in the free border of falciform ligament को मतलब वो falciform ligament को nearby it is attached to falciform ligament and extended from the umbilical fissure to umbilicus. So we discussed about the 5 ligaments. And anterior face is adherent to the diaphragm. Lesser omentum anterior face is adherent to diaphragm. So lesser omentum is attached to liver from esophageal notch to portal fissure, and with it has omentum name ना, so उसका नाम के nearby it is contact with the parietal surface of omasum, and anterior face is adherent to diaphragm, and posterior vena cava is embedded in the left border, holds it in position. Anterior face it is attached to diaphragm and posterior vena cava is embedded in the left border. Anterior face, lesser omentum का anterior face it is attached to diaphragm, and the posterior vena cava है ना वो embedded in the left border of its left border of left lesser omentum में posterior vena cava है. And we now discuss about the gallbladder. These are all, this liver is a question for the cattle, I mean ox, bovine liver. 8 marks को बहुत important question है. And we discuss about gallbladder. Gallbladder is nothing but pear shaped, like pear shaped sac, and it is 4 to 6 inches long, which it lies partly on visceral surface and largely contact with abdominal wall at the ventral part of 10th or 11th intercostal space. So gallbladder is nothing but which lies partly on the visceral surface and largely contact with abdominal wall को direct I mean it has more contact with abdominal wall. क्या बोले थे at the ventral part at the ventral part of 10th or 11th intercostal space, I by C से intercostal space. It is pear shaped sac and 4 to 6 inches long. It is located partly on the visceral surface and large in contact with abdominal wall. Abdominal wall को उस तरह का, I mean which side it is contact with abdominal wall? This is ventral part, 10th and 11th of intercostal space. Ductus coldicus. So this is very important. Ductus coldicus. What is meant by ductus coldicus? Neck continued by the cystic duct, which it is joined the hepatic duct. Cystic duct में neck है ना, उसे join after joining with hepatic duct to form the common bile duct. So what is meant by common bile duct? So दोनों join and form the bile duct, which opens in the ventral part of C-shaped curve of duodenum. Which opens to the ventral part of C-shaped duodenum. Ductus coldicus is a neck continued by the cystic duct and which joins with hepatic duct to form the common bile duct, which opens to ventral part of S-shaped curve of duodenum. So we all discussed about the most liver points which are important. So discussing about the liver. Liver is the largest gland. Liver is located in the abdominal cavity and उसे entirely उसका position abdominal cavity, and it is extended from, it is important, lumbocostal angle to the level of 8th rib है ना. So it has red brown in color and average weight is उसका weight 4.5 to 5.5 kg, and it has 2 faces and 4 borders. 2 faces nothing but visceral face and parietal face, and 4 borders, right dorsal, ventral,